Hello everyone and welcome to this video of Trust TV. I'm your host Memo here, and with us we have Dr. Willardsen. Thanks for being here, Dr. Willardsen.
Thanks, Memo.
In today's video we're going to talk about the factors that determine and affect the cost of dental implants. Now we know that for most people this is the number one question that they ask when considering dental implants is what is the cost? And it's a completely fair question, and there are plenty of implant centers or corporate centers that are coming out with these videos to educate patients with what determines and what factors change the cost of dental implants, which is what we're going to cover today.
Right.
Dr. Willardsen.
So first I'd like to kind of look at, when we talk about these corporate centers, as we've mentioned in many of our videos, that, they're discussing the all-on-4 procedure. So let's take a look at a schematic diagram of an all-on-4 procedure. So this is what you would get at these implant centers that offer teeth in 24 hours. So they pull the teeth, place the implants, make the final set of teeth, and put it in 24 hours. So we'll talk about that. There's a lot of ramifications and risks that go along with that. We cannot speed up the healing process. The body takes its time to heal. The implants, the bone, the tissue, everything has to heal at, we just can't speed up that process. Yes, we can use platelet-rich plasma. We can use BMP. There's a lot of things that we can use to help speed the process, but there is no magic, right? So, but let's look here at this all-on-4. So, as we look here at this case, and we notice, so all of the implants again, and I say this all the time, but everything is concentrated in the front of the jaw. The teeth are all concentrated right here in the front, and they've not placed the molars in the back. So it looks great when the patient smiles. Obviously, if they've gone from a situation where they've got a lot of decay or they're missing teeth or they've been in dentures, it looks great and they feel a lot better. But the functionality and not having these teeth back here, that's a huge deal, because the goal is to replace the mouth, the teeth as it functioned physiologically prior to losing their teeth. So, not having these teeth back here is a big deal. So that means all the force is concentrated in the front. And we can see it also in this x-ray. So if we take a look here, they could have easily placed an implant, back in this area. I mean, they're stopping at this point when in reality they need teeth way back here, and they've got sufficient bone to place an implant back here. But the all-on-4 procedure is just that. It's a procedure that it's kind of the same for every single patient. And that's where they're able to offer teeth in 24 hours, because every case, every patient gets the same thing. But here at Trust Implants, we custom tailor the case for what's most ideal for the patient. We place 6 implants, we place 8 implants, whatever is going to be the best thing, so that long-term, 1, we've replaced back to the second molars, and 2, we have sufficient support in the back of the jaw to support that. Because when you bite down, all the load is in the back. It's not here in the front. So,
Right.
So that's one thing to consider when you're considering having dental implants or restoring your smile with dental implants, is the quantity of implants, position of implants, the distribution of implants, and then the load factors. So, of course, the materials, the quality of materials, the quality of the prosthetics. But let's get into, they've got these 9, factors that affect or potentially affect the cost of the implant. So let's look at each of these factors. Okay, so we'll get into the video here.
Are you thinking who, what, when, where, why dental implants and the price that follows?
I didn't know that there was going to be money involved.
Well, don't worry. We have our team on standby.
For the patient to say, I didn't know there was going to be money involved, I mean, come on. I mean, let's be honest here. Of course, the patients know it's an investment, and it's a life-changing procedure that is an investment. So you want to make sure that the investment that you make is most ideal for your situation. And so we'll continue and look at these different factors.
9 factors that affect the cost of dental implants, with the biggest influence being at number 1. Starting at number 9, geographic location. Take it away, Dr. Chow.
Thanks, Emily. So having dental implant treatment in large metropolitan areas may be significantly more expensive than smaller towns.
You know, again, I want to go back to and reiterate providing treatment that is most appropriate for the patient. At these corporate implant centers, they provide the same procedure for every patient. So it might make sense that you're going to spend less in Des Moines, Iowa than you would in Los Angeles, California, if you're having the exact same all-on-4 procedure. But if you're having a procedure that is most appropriate for you, whether it's 6 or 8 implants or whatever the case may be, it makes no difference if you're in LA or if you're in Beverly Hills or if you're in Kansas. You know, I mean, you want to go to a place that you can trust. You want to go to a place that, now if the best doctor is in Kansas, go to Kansas, or if the best doctor is in Beverly Hills, go to Beverly Hills. The geographic location should have zero bearing on your choice as to where to have the procedure done. That's my thought.
Yeah. And I also think that if this were true and price were to change depending on geographic location, I think it would be very minimal. Like how much cheaper can they get in Iowa than we do here, right? Especially like if you're in a larger area, you're placing more implants, so in a way you could get
maybe a better deal.
Better deals as, at practice you can get bulk or something like that. So if it is true, which we talked about not being true, I don't necessarily think it'd be that much of a difference.
Right. Is it worth it to go to Iowa to have the work done when the doctor, that's your doctor, and if you live in Colorado and you're having to go to Kansas City or something, or Kansas, a small town in Kansas, is it worth it to jump on a plane anytime you need an adjustment or anytime if something, needs to be adjusted? So in reality, the geographic location should have zero effect on the cost of the case. Again, look for who's the most trained, who's going to give you the best result for the best price. I mean, that's, in the end, that's what you want. And so for me, the geographic location should, in reality, not have any bearing on a patient's decision, to have implants.
Therefore, traveling outside large metropolitan areas to have the procedure done can save you a lot of money, even after travel costs.
So if you're only looking for saving money, that's your only objective. You're not really concerned about the outcome. You're not concerned about the quality. Your only objective is to save money, then this video, I guess, has some merit,
Right, but that's not, in this channel, we're not promoting that, because we keep promoting getting it done right the first time.
Right.
Which is, you don't want to, spend half of what you would have spent and then 3 years later have to spend, the same amount.
Yeah.
And then also, I feel like with this geographic location, we get plenty of patients from out of state, from here out of the country, coming into this large metropolitan area just to get the work that you do done, because they know, they've done the research, they've looked at our YouTube channel, they've looked at reviews, they've looked at everything, and they've seen.
They're flying from Iowa, they're flying from
Exactly.
Ohio, they're flying from Florida or from Texas or wherever, So I don't know why they would even mention this, because at the end of the day, it's doctor training, it's trusting the practice of the location you're having the work done. There's so many variables that the geographic location shouldn't have any effect on your decision as to where to go, unless you're purely looking at the price, and that's all you care about. So,
Yeah.
All right, let's move on to number 8.
In-house labs versus outside labs.
What does that mean?
Prosthetic teeth are custom made by lab technicians in a dental lab. A dental implant surgical center with an in-house lab can help control the cost of the production of the teeth and be able to control the quality of the prosthetic.
This, has some merit, and of course here we do have an in-house lab. But there are some cases where it's necessary to send the case out, to do, if the patient has a certain style or design, or if the load factors are such that they need a different technique. I mean, there are situations where the case needs to be sent out to an outside lab. I mean, I can think of different scenarios, very detailed scenarios that would be probably kind of belabored to talk on this. But, having an in-house lab is great. Of course, it saves you some money, but at the end of the day, the quality of the work is the key. The skill set of the technician, the skill set of the surgeon placing the implants, and the skill set of the prosthetic, the materials. The other thing that they're not mentioning is, if you go to one of these corporate implant centers, you're seeing two different doctors. So the overhead of the case, you're having to pay two separate doctors. So that's going to increase the cost of the case. And unless these guys are, unless the oral surgeon or whoever's placing the implants is doing it at a much reduced rate and just wants high volume. So in order to justify, the oral surgeon to place the implants, they got to do a lot of implants because then you have the restorative doctor who's restoring the teeth. So if you have a case that the price point is so low, but you're having to pay the surgeon and the prosthodontist or the general dentist or whoever's restoring the case, you start separating and spreading that money around, and pretty soon they have to do a high volume in order to justify the cost of the case. And so you could actually end up getting a much lower quality result because it's spread so thin if they're charging such a cheap price. In-house lab, yeah, definitely. I mean, you save a little bit, but there are some cases where it's necessary to send it out. Again, not something that you want to base your decision on when having the procedure done. You want high quality, and whether it's done in-house or if it's done outside, it's not going to really affect the cost that much. It helps this corporate center because they're paying their technicians a low amount in order to turn these cases over. And so in the end, you actually may end up with a worse result because it's corporate. They have venture capital money. They have to meet their marks. They have to meet their numbers every day. And so somebody, the man is overseeing this practice, and they have to hit their marks. Whereas in a private practice, like Trust Implants, we just provide the best prosthesis, technique, procedure, materials, because we have the only person I have to answer to is myself and my gut and my my morals in giving the patient the very best possible result that I can give them.
Yep. It really comes down to that, like we've talked about it. We mainly focus on what's best for the patients, whether it is doing the prosthesis in lab or if it's something more complex, in-house, sending it out for the best result for the patient.
Right.
And these corporate companies, they just want to get it done quick. They pay
turn and
technicians.
burn.
Just like like you said, any big corporate, they just care about the numbers more than they care about the patient.
I mean, there's venture capital, somebody who's invested in this company that is all they care about is the bottom line and the dollars. And so, but in a private practice, of course we have our overhead. Of course we, need to do cases, but we also will only do the very best for each patient. And a lot of times that is missing in some of these corporate implant centers.
On the materials we use. We have the advantage of buying in bulk for better quality products, therefore reducing the cost of the prosthesis.
Okay, so here is their case. Obviously all on 4. There's no more implants in 4 here. Decent distribution. But, as I look at this, I see this gray area here. So there's a titanium framework underneath this prosthesis. Very cookie cutter. The underside of the prosthesis, or what we call the antaglio side, I mean, there's a good 2 millimeter, 3 millimeter gap here. And this goes back to this teeth in 24 hours. So let's say we were to place these 4 implants, and I had to make an incision to place the implants, put the implants in, and then suture that closed. At that point, you know, the tissue is swollen, right? It has to settle down. It has to heal. And so if I'm going to make this prosthesis in 24 hours and put it in the mouth, and it's the final thing, within about a month, there's going to be a gap that's, you know, 3-4 millimeters, because the tissue has now changed from the time that I placed the implant. So, you know, again, not really being concerned with the outcome. It's just, we do this in 24 hours, come on in, get your teeth and your implants done in 24 hours, and then you're good to go. I can't see it. I can't see the benefit of that. You know, I'd rather take the time necessary in order to provide the patient with the very best long-term aesthetic results. So that, and the reason that this gap is important, because every time the patient eats, everything is going to get stuck in there. Like, the food is just going to get so impacted in there because there's this, you know, 3 millimeter gap. Whereas if I wait 3 months, let the tissue heal, and then make, you know, the final impression, close this gap up so that the fit against the tissue and the bridge or the prosthesis is really tight, the food impaction is much, much less. Even though with every implant case you do get some food impaction, but when you have a gap like this, man, I mean, it's every single time they eat, everything's gonna get caught underneath there, you know. And as you can imagine, after every meal, let's say you're out to dinner with, you know, with your spouse, and you're eating, and, you know, underneath your implant prosthesis, for one, you're missing your molars, so you can't chew as well as you would if you had your own natural teeth, or if you had it done correctly and you had an all-on-6 and your second molars are replaced, and the fit of the prosthesis is tight against the gum. You know, all of those things take time. It doesn't happen overnight or in 24 hours. The healing process has to just go through its process. Yeah, there's no rush. There's no way to rush it.
Yeah, and it's a surgical procedure.
Yeah.
Like, it'd be scary if, you know, if it really took 24 hours to do, especially for something that we use every day and it's used so much.
Yeah.
It takes time, you know.
That's a great point. When I do, like, for example, the PMMA, which is like the trial version of the final prosthesis, and it's been 2-3 months since the initial surgery, even then I still have a 2 millimeter gap between there, and I still will close that gap. So on the final, you know, it's tight, and so I mean, literally, I see it every single day. I have to close that gap and keep closing it until it reaches a point where the antaglio, the underside of the bridge, and the gum tissue are so intimately integrated or attached, it just minimizes the food impaction. And so also it protects the implants, because if you have chronic food impaction around these implants and it's, you know, got debris in there all the time, the chance of infection around the implants goes way up. You know, if you can imagine, if there's just chronic, constant food stuck underneath there, the chance of infection goes way up. So again, you know, you might be getting your teeth in 24 hours, but the risks are very high. I mean, the bone has to integrate, the tissue has to heal, prosthetic integrate, you know, the prosthetic adaptation has to be ideal. None of these things can happen in 24 hours. It's got to take its time, and that's what we do here at Trust Implants. We want the very finest results for each of our patients, and it's not about speed or getting it in 24 hours. It's about in 6 months, when the case is finished, that the patient has everything they need that is restored from what they lost when they lost their teeth
itself. So those savings can be passed on directly to the patients.
Using an outside commercial lab, however, will have its own profit margin that brings up the cost for the provider and is ultimately passed on to the patient fees. Therefore, operating an in-house lab is not only more cost-effective, but can also be an indicator of how much experience the practice has in placing implants.
I'm not exactly sure how having an implant in-house lab has anything to do with operator experience. One, when you go to a corporate implant center, operator experience is going to vary, both surgically and prosthetically. And we hear from some of our patients that have been through some of these corporate implant centers, you know, they'll see one doctor at one point and then they go back in for an adjustment or whatever, and it's a whole new doctor. So that they don't know anything about their case. They're not intimately, you know, they don't have an intimate connection with the patient because it's like this revolving door of whether it's the surgeon or the prosthodontist. A lot of times they hire surgeons that have their own private practice. So the surgeon will come in and place a few implants and then they go back to their private practice. So, I mean, every case is different. I don't know the situation of this corporate implant center, but I do know that, you know, in a private practice setting where the doctor is in control of each case, both surgically and prosthetically, he has a connection with the patient. He knows the case. He knows from A to Z, from the planning of the placement of the implants to the final delivery of the prosthesis. He knows that case very, very well. Whereas when you break up the continuity and you have one guy placing 4 implants and that's all he does is place 4 implants, and then another person who does the restorative and has to do the restorative based on the placement of those implants, you know, they're kind of left to the, left to the surgeon as to where the implant position is and just have to deal with that. So, you know, having one operator is actually very important as well because it actually brings the cost down and it brings the continuity of the case more tied together. It's like, kind of like having a contractor. If you were building a house and you had 2 or 3 different contractors building the same house and they're not communicating, you can imagine some of the difficulties that might bring about. So, all right.
Single tooth or full arch?
Single tooth or full arch? They have nothing to do with this conversation because if you have a single tooth implant, you don't need a full arch of implants. So I'm not sure. I mean, obviously a single tooth implant is for somebody who's lost their front tooth or one tooth, and the cost is much less than somebody who's lost all of their teeth. But I feel the reason they bring this up is because they're okay with pulling good teeth in order to provide a full arch of implants. So, you know, if a person came in and they, you know, had a few areas of decay and were missing a few teeth, you know, they may encourage the patient to extract everything. You know, let's just take them all out, do an all-on-4 and be done with it. And you'll never have to deal with your dental problems again. You don't have to, you know, floss, you don't have to deal with decay. I mean, but in reality, it's very unethical to pull teeth that are good. And so, you know, a single implant is one tooth versus, you can't compare, you know, one tooth versus all-on-4, you know, full arch of teeth. So not sure why that's even.
The first question that you need to ask yourself when deciding what route for dental implants is what work do you need done? Do you have a few teeth that have some problems and do you need to go the single implant route? Or are the majority of your teeth in bad shape and do you want to look towards a full mouth solution restoration?
There are many types of dental implant systems, and whether you need one implant or a full mouth implant restoration will determine your base costs.
Some offices may charge by the implant and other offices may charge a flat fee.
Okay, so this is a good point. So what he's saying is, you know, some offices will charge per implant, other offices will charge a flat fee. It tells me that they charge a flat fee and they're going to push the patient, encourage the patient to pull their teeth out. You know, they want to get that flat fee. They want to do what they know how to do, which is all-on-4, place 4 implants, make a prosthesis, and then be done with it. They don't want to deal with the single implant and then fixing adjacent teeth because that's not in their wheelhouse. That's not part of their system, you know, with their in-house lab or whatever the case may be. All-on-4 implant centers are just that. They're corporate, venture capital supported, all-on-4 implant centers. They got to meet their marks. They've got to meet their financial goals. And the all-on-4 it's very easy to pull all the teeth and throw in 4 implants and make a fake set of dentures that are screwed into the mouth. Obviously, there are cases that there's no other option. The teeth have to come out. But if you have good teeth and they're suggesting removing those teeth because that's part of what they know how to do, is just pull teeth and place 4 implants, I would be very cautious of that. We talked about that news piece that came out in Arizona. I don't know her preoperative situation, but if she came in and had good teeth and all she needed was a few implants to replace missing teeth, but they ended up pulling all those teeth, I mean, that's just straight up malpractice. So be very cautious that if you have good teeth, but you're just missing a few teeth and maybe you've got some teeth that are decayed, I can't imagine, like one of my worst fears or nightmares, I'll wake up in the middle of the night dreaming that my teeth have all fallen out or I need a all-on-4. It's not, I mean, it's a great procedure. It is life-changing, but it's also only for those that absolutely need it. It's not for everybody. All-on-4 is not for everyone. It's, not for all, as I'll say. All-on-4 is not for all. It's for those that need it.
Right. And just like you said, a lot of these corporate implant centers, they're going to try to push to do the all-on-4, pull out good teeth.
Yeah.
One, like you said, because it's a lot easier for the doctor to do that.
Yeah.
And 2, they make way more money than to just placing 2 or 3 implants and keeping the same teeth.
Having the dentist looking at your case and determining, looking at each tooth individually, looking at x-rays, and coming up with a plan that will resolve the problem the most effective way. Again, I don't want to reiterate it, but do not remove teeth that are good just to fit into the all-on-4 category.
And do you want to look towards a full mouth solution restoration?
There are many types of dental implant systems, and whether you need 1 implant or a full mouth implant restoration will determine your base costs.
The times that I see, 1 implant versus a full mouth reconstruction is very rare. If I see a patient coming in, they're just missing 1 tooth, it's not even on my radar that they need a full mouth, a full mouth of implants, and so.
Yeah. And then also how long they've been missing that tooth for, right? Or how long they've been missing multiple teeth for,
Right.
like that. It all comes down to what's best for the patient.
Best for the patient,
like we've talked
exactly,
about.
right.
Given by our prosthodontist rather than charging by the implant. A benefit of having a fixed price is during surgery, the surgeon can make decisions medically that won't be surprising to you after the procedure. Once the treatment is done, when do you see me again? Is that included in the cost?
They're able to charge a fixed price because they do 1 procedure, they take all the teeth out, they place the 4 implants. So it's very simple to add and say we only charge 1 price for that procedure because they only do 1 procedure, and so, very easy to say we only charge a fixed price. But if the patient needs, different procedures on different teeth, we want to try to preserve the teeth. We want to maybe replace some of the teeth with with implants, replace missing teeth with implants. We can't just do that for a fixed price because, there's different procedures that have to be done in order to fix the patient's mouth. And here at Trust Implants, we evaluate each case, determine what is the very best procedure and outcome, and then give a price for that. The lowest price possible, but one that solves the problem. And it's not a one-size-fits-all type of a situation where they get the same procedure and we charge 1 price for that procedure no matter what. Every case is custom tailored. We give them the very lowest price possible for their situation.
Once the treatment is done, when do you see me again? Is that included in the cost? How often do you see me? Is that included in the cost? If I'm out of state, can you help me find somebody? All these are very particular questions that you should care about because you're making a major investment in yourself.
Number 6, bone grafting alternatives.
Throw me a frickin' bone here.
If you have severe bone loss, you may require special surgical techniques to be performed prior to having an implant procedure done. First is called a sinus lift. This is a surgical procedure that is performed in order to increase.
So the grafting alternatives. There isn't a time that I place an implant where I don't have my bone graft ready to go. It's just part of the process. Grafting is an essential part of the process, and they talk about bone grafting alternatives. So the potential of not grafting at all, or not even considering doing a sinus lift, because the all-on-4 procedure avoids the sinus, it avoids some of the anatomical positions so that they don't have to do the bone grafting, because the bone grafting delays the process. They can't turn around a case in 24 hours and have just done a bone graft. It's just not possible.
In order to increase the amount of bone in the upper jaw, it may be required before getting dental implants. The second is bone grafting. It's a surgical procedure that utilizes materials to replace missing bone in the jaw. However, the bone grafting process can be lengthy, requiring healing time for more bone material to be added and fused with the jaw. And last are zygomatic implants. These are often used when a patient's jaw lacks enough bone to place traditional implants. Surgeons with advanced training and experience often use a technique of placing a longer implant into the cheekbone instead of the jaw. Zygomatic implants can be placed in a single surgical procedure, sometimes making bone grafts unnecessary.
So again, they're trying everything they can to avoid bone grafting. And again, bone grafting is an essential part of knowing how to place implants and how to properly position each implant in the right position so that the load factors are sufficient and is satisfactory enough to support the load for long-term success.
Which bone grafting, it's a surgical procedure that's not taught in a weekend course, correct?
I mean, it's brushed upon, and there are weekend courses that you can learn how to do grafting, but bone grafting is a very technique-sensitive procedure. Every qualified surgeon has their different techniques on how to graft, what materials to use, and also in each position, the grafting techniques that we use here at Trust Implants are custom tailored for each patient and implant site individually. So it's very hard to throw every case into bone grafting is a very specific procedure for every single patient, and is such a wonderful procedure. It regenerates the bone. I love it when I graft a site. We've put the proper type of material in, done proper grafting. I go back in there and I can't even tell what's the patient's bone or what's grafted bone. That's when you've got a good graft, Mm-hmm. And again, like I said, that does not happen in 24 hours. It's a process that has to be done methodically, and it's a very delicate technique, but when done done well and done methodically and done for the patient specifically, it's what makes these cases last long term.
Yeah.
These techniques can bring up the cost of dental implants, as they require extra time and materials. However, when you eliminate bone grafting, you're saving time and complications with implants.
Oh man, I mean, he just could not have said more of a corporate statement. Eliminating bone grafting, you're saving time, you're saving money, you're saving all these things. But what you're not doing is giving the patient the very best outcome. And that's a corporate statement. They don't want to waste time in letting the graft heal. They don't want to spend more money on the graft. Or a lot of times the surgeons placing the implants aren't versed in grafting, so they are stuck with the all-on-4 procedure, which concentrates all the implants in the front of the jaw. Usually there's sufficient bone there, and so they don't have to do as much bone grafting. And so that's a very corporate statement that you just said right there, and it proves my point of do what's best for the patient, not what's best for the corporation that's pushing you to do a lot of implants.
Yeah. What I've noticed with these corporate implant centers is they're promoting everything they can to say, hey, let's make this very delicate surgical procedure as quick as possible so then you can have your smile right away and as cheap as possible, which is it's not the case for this.
No,
like
it's just
again,
not.
it's a very delicate surgical procedure. Everyone's mouth is different. Everyone's mouth got to the point to where they are because of different reasons, right? So you're going to need different techniques to fix that.
I love that you just said that. I mean, you have to custom tailor the techniques for the patient, and avoiding grafting or avoiding placing implants in areas that might need a little bit of grafting. Or a lot of times I'll see these cases come from the corporate centers that there was plenty of bone there. Why not put a 6th implant in just to provide more support for the patient and the prosthetic, and so that long term they don't have these issues, or we can add the 2nd molar so that they can chew in the back, and we can there's just so many factors that patients unfortunately kind of get caught up in the cost and the speed.
Yeah.
And those 2 factors really should be on their list of importance, like way at the bottom. I mean, of course, the cost. I mean, it's got to be something affordable. It's got to be something that that's achievable. And here at Trust Implants, we give the very best price, but we give the very best solution for long-term results. If that requires a sinus graft, it requires a sinus graft. If it requires placing implants in the back of the jaw, we place implants in the back of the jaw, and we do what's necessary to do that so that 5, 6, 7, 10 years down the road, everything looks great, and so we don't avoid those things in the name of speed and price. And a lot of these corporate centers, that is their number one goal: fast and is the cheapest route.
Yeah.
And of course we are sensitive and cognizant of the cost and the time, but we also want good results.
Yeah, well, the cheapest route as well, but then also the easiest route. Because if I
Yeah.
didn't know anything about dental implants and I saw this video, I'd say, I want to pay the least amount of money and I want it as fast as I can, not knowing, because that's what's easy for me to do.
Right.
Like, it's so much easier for
It
me to...
sounds great, right?
Yes.
Like,
Yeah, but as we know, like, something that has value never comes easy, right? It requires work.
Exactly.
And this is what I just see here. But again, we know this because we're in this industry and we see
Right.
this every day. But for a patient that doesn't know this, they're going to think it's easy. That they're making it sound so easy. Let's get it done, when they don't really know and understand that a few years down the line, it's when they're going to actually see.
Of course, they'll see an ad, get your teeth done in 24 hours, have this problem that they've had for years and years. I mean, how long did it take for their teeth to get into this situation and have it fixed in 24 hours? I mean, that sounds pretty appealing to me,
If it was real, I would do it. But now knowing this, I would try to avoid those places
Yeah.
at all costs. So.
Absolutely, yeah.
Next, we have number 5, doctor experience level.
Doctor and experience level, absolutely critically important. But a lot of times in these corporate implant centers, I know this for a fact because I get messages all the time that they need help, they need doctors, they offer bonuses and a certain amount of money to move to Kansas City or whatever, because the doctors that actually have experience, they're in their private practice. But you have new guys coming out, you send them to a weekend training course, and then they become the doctors for these corporate implant centers. So doctor experience is very important, but you also have multiple doctors. So you have the surgical doctors, oral surgeon, placing the implants, and then you have the prosthodontist or the general dentist. Oral surgery programs, some of them do a lot of implants, some do hardly any at all. I mean, I know when I was a resident many years ago, I mean, the number of implants for oral surgery residents was 10. That's all they had to do, was 10 implants to finish their training, And I've said this in other videos, I did over 150 implants as a resident, and even that was, it was lots of experience and lots of technique knowledge, but considering the techniques and the knowledge that you need to properly place implants for a good long-term result, you need a lot of experience. And that's just on the surgical side. The prosthetic side is a whole nother factor. Now, if you have an in-house lab and you're only doing all-on-4, it's very easy for a prosthodontist or a general dentist to do all-on-4 prosthetics, which is the teeth. And so doctor experience is important, but at the corporate implant centers, it's a revolving door of doctors. You'll have a different doctor that you see multiple times.
An experienced surgeon can be the difference between implants that can last a lifetime and implants that end up failing. If the procedure must be redone, this will drive up your overall dental implant cost.
How many implants has the surgeon placed? Do they place them on a regular basis? How many full mouth restorations do they do in a year? How many have they done over the last 5 years? You could find yourself in a situation where you'll have to have the procedure repeated later on.
Now, if you're doing the same procedure over and over and over, and it's the all-on-4 procedure, you can get pretty good at it. But the end result is marginal, I would say, compared to having it done correctly with at least 6 implants, good prosthetic design, good material, zirconia, and so you're not going to get that at every center. Even within some of the corporate centers, some surgeons are going to be better than others, some prosthodontists are going to be better than others. So
Right.
You're going to get a mixture of different levels of skill at each location. So
Not only that, but also with these big corporate centers, the oral surgeons don't own the centers, so they don't really have any
vested interest.
Not only that, when someone goes to a private practice or they come here, it's your name, it's your practice. You've had this for 20 years, so if something goes wrong, you have to answer for that.
Absolutely.
These oral surgeons are just collecting their check. If things go south, here's my 2 weeks notice, move on to the next one. So in reality, most people should go for just private practices because it's the doctor's name in the practice that has the reputation, right? They have to hold on to that reputation.
Right.
So.
Yeah. It's not a corporate situation where they're having to meet monetary goals and make sure they do a certain number of arches per month and so there's some good things about it as well. I don't want to completely disregard, but for patients who need these procedures, the only reason we create these videos is to help educate them and help them to make the right choice,
Right.
when they're making these types of investments.
Yeah, we want to talk about what they're not talking about. We're
Yeah.
covering what they're talking about, but then adding to it.
Exactly. And everything sounds like unicorns and rainbows here. It's all perfect and wonderful. This procedure is a procedure. I mean, there's pain involved, there's time involved, there's steps involved. It's it's one that, but when it's all said and done and the procedure is completed, it's a life transforming procedure, no doubt about it. But just so long as it's done correctly.
Not all oral surgeons have equal levels of certification and experience, and some less qualified doctors may resort to lowering their prices in order to attract new patients.
Okay, so here we go back to the price. At first it was, go to Iowa in order to get your case because it's cheaper. But now he's saying, well, you need to go to, which I agree with it, you need to go to an oral surgeon or a certified surgeon that has done a lot of implants in order to have higher success level. But it's contradicting to, it's a kind of contraindication when he's saying that, go to Iowa to save money, but, you want to have a surgeon, doing your surgery, which is true. But it cuts out half of the case, which is, who's doing the prosthetic and how much experience does this surgeon have, because not all surgeons have the same level of experience. A guy that's been out for a year, hasn't done that many, implant cases, he's still learning on how to prepare the osteotomy or the hole for the implant, implant torque, implant position, implant placement. All of that is critically important to the outcome and the long-term success of the case.
At Nuvia, our surgeons and restorative doctors perform these procedures day in and day out. From measuring, fitting, mapping, and ultimately planning out the procedure collaboratively between the surgeon and the restorative doctor.
So they have to collaborate. So you have the surgeon and you have the restorative doctor. They have to work collaboratively. And, you know, here at Trust Implants, you know, the surgeon and the restorative doctor, they're one. And so it, you know, when I write a treatment plan, I carry it through from A to Z, implant position, implant placement, and then prosthetic design is all done with, you know, I have control over that whole process.
Yeah.
Allows us to precisely execute the implant placement.
Number 4, quality of the material used.
What do you think?
Well, I think I shouldn't look directly at them.
Patients need to ask, what are the quality of the materials used? That is going to determine a large portion of the cost.
Now this is a denture. It's a regular denture. It's made out of all acrylic. The pink part and the teeth are all the same materials. Then we move on to the implants.
So she goes from a denture to the implants and the implant material. You know, kind of like we talked about last time, you know, one of the largest corporate implant centers just switched implant companies. And the only, like we said, the only reason you would switch implant companies is for cost, you know. And so a denture is made out of plastic. So, you know, that's, you know, plastic is cheap, it's inexpensive. But here at Trust Implants, we only use zirconia for our final prosthetics. We don't even offer a hybrid or a plastic prosthesis.
Most implant fixtures are made out of titanium. Now this is an acrylic prosthetic. This material is the same material as the denture, just in a different application. It's typically a temporary set of teeth that would go on implants after surgery, otherwise known as teeth in a day. This acrylic is not going to stand to the test of time, which moves us over into the world of zirconia prosthetics.
Okay, so let's look here. Again, they've stopped. It hasn't gone back to the second molar. You know, so they don't have full functionality of the teeth that have been lost. And again, that's how the all-on-4 is designed.
Is a harder material and stronger material than the acrylic. And because of this, zirconia teeth may have a higher initial cost, but it may actually be more cost efficient in the long term because they are less likely to break or wear out. Choosing a cheaper quality material to be used as permanent teeth may require you to have them repaired or replaced later on as they wear down. Here at Nuvia, it is our plan and goal to give every patient permanent zirconia teeth in 24 hours after surgery.
You know, they're putting the implants in, you know, making the prosthesis in 24 hours. I just can't imagine developing and creating an entire corporation around providing the final prosthetic in 24 hours. And not to belabor that anymore, but it's just, you know, I would never, I couldn't with good conscience tell my patients, yeah, you're going to have the final prosthesis, it's going to be perfect and beautiful, it's going to be adapted, and you're going to have it in 24 hours. It's just not possible.
Right. And, you know, we've talked about this multiple times. A lot of these implant centers, this is a clickbait.
Yeah.
Because a high percentage of patients that come in, they'll just say, oh, like, we actually need graft or we need this extra. You're not a candidate for the 24 hours, but we'll still get it done in however long.
Right.
So this is just to get you in through the door and like get you all excited to get a consultation, see the price, and we could do this as well.
Of course.
We don't want to lie to our patients.
Exactly.
Like we tell them the truth. That when people call and ask how long is the process, we tell them that there's, you know, multiple visits. Sometimes it takes some time because we need to do the try-in. We need to make sure that everything's good. And again, we can market this and we can get tons of people coming in, and you can just say you're not a candidate like like someone else is, and just start the process.
Yeah,
right?
yeah. So maybe 10% of the patients that I see might be candidates for teeth in 24 hours, but even those I wouldn't suggest it because I want an ideal outcome, and I don't want to rush through the process so that, you know, just to meet this need of claiming that I do it in 24 hours.
Yeah.
And that's a corporate thing. That's just a way to bring people in. It sounds great in theory, but in reality, it's just not reality.
Yeah, which I feel like if we were to try to implement this, it would be a lot better for you, because you, instead of
Turn and
6
burn,
visits,
yeah.
you'll see them in 1 or 2 visits and then on to the next one. It's actually harder for you to see them multiple times because you're not seeing as many patients. But again, it's what's best for the patient.
Right. And I can't resolve the needs and the desires of the patient in 24 hours. It takes time for me to get to know the patient. Aesthetically, what it is that they want, what shade, what shape, what color. There's so many factors that there's just no way I could gain or know in 24 hours. It's not possible. And especially the final prosthesis, the end result, like, okay, you're done. See you later, and so I think it's a long shot to build a whole campaign around 24-hour smile and expect aesthetics and functional results that are going to last a lifetime.
Yeah. I wonder how many people actually come back after the 24 hours for
it leaves me with so many questions. It leaves me with the question of, what brand of implant are they using? How do they adapt the prosthesis so that the adaptation doesn't allow for a lot of food impaction? It just leaves me with so many questions. I've been doing this for such a long time. I know what's real, I know what works, and I know, what the patients demand, what they want, what's best for them. And this just leaves me with so many questions that I just can't imagine that it's really a reality. So I'm sure it is for a lot of people, because that's what they're claiming. So they have to, meet this, this advertisement that they say they do in 24 hours. So.
However, patient's anatomy will dictate the type of prosthetic they get.
Number 3, out-of-country dental procedures, otherwise known as dental tourism.
Those considering traveling out of the country to have an implant procedure done should be cautioned. The procedure and materials used in other countries may not be of the same quality as those in the US.
So they're cautioning people to not go out of the country, which I would do the same. I would caution them, to not go out of the country, because if you have an issue, you want to have access to the doctor relatively easily that can be resolved. But they're also offering teeth in 24 hours. I would caution against having your teeth done or your implants done and the final prosthetic done in 24 hours. So, they're putting this caution out there: don't go to Turkey or Mexico or whatever to have your implants done. But they're also suggesting something that is almost worse than going outside the country to have your implants done, which is trying to get it done in 24 hours. So it kind of contradicts the reality of implant surgery, implant prosthodontics, and providing patients with something that they can count on, that they can trust, that will last them, and that they can feel good about.
On to number 2, general anesthesia.
Now you will go to sleep, or I will put you to sleep.
There's generally 3 anesthesia options that are used for dental implant procedures. First is local anesthesia. This option is generally reserved for single implant procedures. Second is IV sedation. This option may be offered for single implant or full arch procedures. It's important to point out that there is a chance that the patient will be somewhat conscious and aware during surgery under IV sedation. Third is general anesthesia. When a patient is under general anesthesia, the surgical team can better protect the airway, preventing any unwanted objects from entering the lungs. General anesthesia is generally the more effective option when it comes to anesthesia for dental implant full arch procedures. However, it can be more costly. At Nubia, we have a dedicated anesthesiologist performing the general anesthesia at no extra cost to you. This way, the implant surgeon can focus on the procedure itself.
Okay, so anesthesia, obviously every case that we do, if it's a full mouth case, without a doubt we use a MD anesthesiologist. We don't use CRNAs. We don't use DDS anesthesiologists. We use physicians that are anesthesiologists. We have all the safeguards. We have anesthesia machines. We have backups. We have everything that we need in order to provide safe, effective anesthesia. I mean, that's just a given. I mean, you know, to do a full arch case with IV sedation, one, it's incredibly difficult for the doctor because their airway is not protected. And again, it would be, the only reason you would do that is to save costs. There's no reason to provide IV sedation for patients having full arch case, you know, full implant cases. Even with single tooth implants, we provide IV sedation or GA, you know, or multiple implants. So, you know, that's just part of our process. And the doctor has to be versed in how to manage both the surgeon and then also the anesthesiologist. I mean, that's just a given. I mean, we wouldn't offer anything other than general anesthesia for our patients that need, you know, full mouth implant reconstructions.
And finally, number 1, the biggest influence on the cost of dental implants is permanent teeth in 24 hours.
24 hours later.
This is just mind-boggling. You know, the number one determining factor is having teeth in 24 hours. And of course, they quote my man SpongeBob here in 1999. I mean, this is just completely asinine to me that this would be the number one factor for someone deciding what they need when they need dental implant reconstruction, to have it done in 24 hours. The number one factor for patients needing dental implant reconstruction, full mouth reconstruction, all on 6, is quality of materials, surgeon experience, long-term outcome, materials of prosthetics, materials of implants, materials of grafting, position of implants, biomechanics. There are so many other factors, and 24 hours is not even on the list. It should not even be mentioned as the number one. It shouldn't even be number 10. You know, I mean, there is no reason that this should be the number one determining factor for, you know, dental implants.
Yeah, like you're saying, it shouldn't be on the list because after you think about all the other factors that you just talked about, at the end of just considering all those factors, you were going to think about it and say, after considering all these factors, I don't think this is going to take 24 hours.
Right.
Like, this procedure shouldn't be this quick if you're considering all these things.
Absolutely.
And for them to have this as number one, they're just selling. They're selling the 24. They're selling you. Look, you're getting your new smile in 24 hours. Come on in. We'll take care of you, but they really don't.
Yeah.
I
mean, honestly, when I watched this video, I was shocked. I'm like, really? Number one is 24 hours. That's pretty amazing. That's
what's what they're selling. Like
that's what they're selling, and
yeah.
it screams that corporate turn and burn. We got to get more cases in here. We need more. These surgeons need to place more implants. Our prosthodontist needs to make more prosthetic teeth in our in-house lab. You know, it just is just mind-boggling to me that they would even consider saying that the number one factor in choosing a doctor or a surgeon or an implant center is that it's done in 24 hours. It just is, anyways. But, you know, these videos are great. It's important to be able to help patients understand you know, it's a big decision, it's a big investment, it's a life-changing procedure, but there's no reason that they should fall into these clickbait kind of, you know, get it done, get it, you know, done quick, done cheap, every patient gets the same procedure, all on 4. Every case looks almost the same. Every single one of those cases to me looked like it was a cookie cutter, you know, solution. Right. And so, you know, to say that having it done in 24 hours should be your number one decision tells me that you should look elsewhere.
Right. Yeah, I'm really interested to see what the reasoning or the reasons are for. Does it show after this what the reasons are for this being number one?
Let's see.
And even I feel like not only dental implants, just like in
Anything.
any procedure. Like for example, when I was 18, 19, we all know that everyone gets their wisdom teeth pulled out, right? So I went into the dentist or oral surgeon. I'm sorry, and they looked at my mouth and they said, "Hey, you don't need to get them pulled out." They could have made money off of me,
Of course.
but they said they're coming in the right place. You don't need to get them pulled
Absolutely.
out. They're
That
not
was
going to hurt
ethical.
anything. I was like, great, let's do
All
it.
right.
So they were doing what was best for me. So again, that's what I'm saying. Just for something that's not as complex as dental implants, this doctor said, I don't want to charge you. You don't need this. And like what makes me think of these implant centers is, if you need it or not, they're going to try to do everything they can to sell you that case in the 24 hours because it's what we think it's best for you, when in reality it's not.
Just not. I've done way too many cases. I've seen way too many complications of patients that, fall into these traps. And again, I reiterate, it's a very technique sensitive, it's a very delicate procedure. And once it's done correctly, the aesthetic and long-term results are life-changing, but the patient needs to have some patience, and nothing that's worthwhile can happen in 24 hours. And so, it's good to review these videos because, they're putting it out there. So, I feel a little bit of a responsibility, one, because of my background, my training, and the history that I have because this is a relatively new company, so, it's important that patients understand what they're getting into when they're considering these procedures, because it's important to have your teeth. Our teeth are critically important.
Right.
And when done correctly, it's an amazing process. But don't fall into the trap of, having it done overnight or, even the all-on-4, which I'm not even going to get into that, is just, it's something that really needs to be considered when a patient considers these procedures. So.
Yeah, which is one thing that we continue to educate our patients in is do your research. That's why we put these videos out there. Which again, Dr. Willardsen, thank you for covering this whole video. I know it took some time, but our viewers, our subscribers on YouTube really appreciate. We see the comments of how they're being educated and all that. So we'll continue to put these videos out there. Thanks for watching this video of Trust TV. If you have any questions or any concerns, or you'd like to set a consultation, online consultation with Dr. Willardsen, feel free to leave a comment in the section below. Don't forget to subscribe to our channel and hit that like button. Again, thanks for watching Trust TV.